This is Dr. Amelia Beakey, founder of This Osteopathic Life for the health of all things. As a specialist in neuromusculoskeletal medicine and osteopathic manipulative medicine, I have dedicated my professional career to the study of the intricate design of the human body and understanding how the structural components, nerves, muscles, and bones can influence the function of the entire system. Quality movement directly relates to quality health, and it's important to have the right tools for optimal strength, flexibility, and mobility. Through these videos, I lead you through clear and concise exercises that you can use to find optimal health through movement. It is important to note that while I am a physician, these videos do not constitute medical advice, nor do they replace the important relationship between you and your personal physician. Before beginning any exercise plan, it is important to consult with him or her to ensure these are the right exercises for you, your particular diagnoses, and your current state of health. Thank you for joining me, and let's get started finding best health through movement.
Hello, this is Mary Goldman, an osteopath in Michigan, and I wanted to share with you today how I train posture. Posture, which is oftentimes a problem for Americans, is most easily demonstrated to a patient by showing them a picture of themselves standing from a side view. Usually I use their camera. In this way, I don't have to worry about problems with taking pictures that are unauthorized. In other words, I use their cell phone. The way to check and teach posture is to work on getting the pelvic tilt so that the ASIS is in alignment with the pubic symphysis. And the shoulders are not up here. They're relaxed to the sides as if the person was being pulled from side to side. The posture then allows the head to be very loose in its motion all around an axis. The head is neither in front of the body nor is it pulled with the chin back in. There is no line under the chin that comes from pulling the chin back in. Then what you are doing is working to have them stretch the body long to a point right behind the top of the head above the foramen magnum. As you stretch very tall, coming downward in the pelvis, we'll talk about that in the core, lower core training, and then stretching up to the top of the vertex as if the ears were being pulled upwards at the backs, what you find is a lengthening of the body. This makes it possible for you to be able to turn in a very smooth motion, maintaining the body curves, which protect the back, and to side bend or to forward bend or backward bend, stretching the back, this being the full length of the back in yoga, and then stretching the neck to match. Body variations that you frequently see, probably most commonly, particularly with back pain patients, tucked under pelvis. When you lose the pelvic tilt, what you are dealing with is the hamstrings and the gluteus pulling drastically under. This comes oftentimes from sitting in a chair in a common American posture. Where you should be in a chair, we'll discuss on another video. So, as you're standing tall, if you were to shorten the psoas between the origin and the insertion, because it comes forward and in front of the hips, you end up with this common posture. Notice the head forward, the weight back in the heels. Or if instead you were to again tuck that pelvis under, head is still forward, weight is very back in the heels, very hard to walk without putting your foot forward and hauling yourself forward. Takes a lot of effort to walk that way. The third variation is to drop the upper body into a sway back. This unfortunately results again in head forward, or you end up chin tucking to get your head over top of your shoulders. And unfortunately, it also ends up in a lot of back discomfort. The psoas is shortened and you're not able to use your core muscle. To use your core muscle again, Bring yourself so that your weight is between your big toe, your little toe, and your heel, and then flatten your pelvis in the front so that the ASIS is now in alignment with the pubic symphysis, and then stretch your body up to that spot just behind the top of the head. You can shake your head. If you find it moving very loosely, you're probably dealing with a very nice stretch in your body that has put your head over top of your shoulders and your body. That's why it shakes so easily. Now, if you take it forward, it's going to feel very tight because you're not moving around an axis. You're moving like a wheel that's going like this. It's not very comfortable. The other thing I like to work with my patients is alignment, because a lot of them will walk with their feet out trying to balance better, particularly if their weight's back. Frequently a shortened psoas will end up like this when somebody's trying to correct it, instead of having that beautiful stretch across the front of the body. So we want the knees and the feet and the hips, the ASIS like headlights looking forward at the same direction as the knees, and in particular the area just below the knees. That plateau, tibial plateau, should be directly underneath the knees in a V, facing up into the patella. The feet should be under the body, not out here, under the body, at least less than hip width apart. Some of the Olympic trainers actually want them right together. When you bend, the knees should go directly in alignment with the hips and with the toes. Oh, it's all right if you do a little turn out of the toes. That's quite acceptable. But you don't want a lot, because now you're twisting your knees. You're either twisting them inwards or you're bowing your leg out and you're twisting them outwards and your weight's falling to the outsides of your feet. The reason you don't want this is, if you think about a chicken bone, if you take the thigh and the drumstick and you're trying to break them apart, you twist. And that's essentially what you do to your knees when they're not in alignment. This causes a lot of wear and tear on the knees and a lot of unnecessary surgery that could have been prevented by proper alignment. And a lot of back pain comes from improper posture, sitting and standing. Thank you.
Thank you for joining in on this episode of This Osteopathic Life, Best Health Through Movement. This is Dr. Millie Beakey, and we'll see you next time.